Well, aloha, my name is Malia Ka'io and I currently work at the University of Hawaii at Manoa. So today we're here to celebrate all of the community health workers that helped throughout the pandemic and continue to help and continue to be on the front lines. So even if you're not a CHW per se, if you are still on the front line and you are helping our Native Hawaiian population as well as our Pacific peoples, so that covers everybody that is of Oceania, right? Of our Pacific Ocean. If you've helped them in some sort of way, this celebration today is for you. A few kapunas in the communities helped us to plan and organize and to actually even just come up with this idea. So Auntie Jessie from Ka'u Rural Community Association and Auntie Adrian from Papakolea, they helped guide us in making this come a reality, actually. And then of course the help from all of the funders. So this event is planned under JAPSON, the medical school at the University of Hawaii, specifically the Department of Native Hawaiian Health and their community engagement.
health worker is someone with passion, commitment, and compassion to the community that they are from. It can be a geographic community, a cultural community, a faith community, and they have a desire to bring a sense of wholeness and wellness to that person's life, whatever that means for the person they're trying to help. It may mean food, it may mean housing, it may mean peace of mind, it may mean helping them find the career pathway that they want to find. During the COVID-19 pandemic, all of us were learning, all of us were trying to understand what the risk factors were, how we could keep our families safe, how we could return to work safely, what to do if we became infected or sick, right? So all of us were learning. And community health workers were some of the very first people to reach deeply into community, to people who may have lost their jobs, to people who may have lost their insurance, to children who all of a sudden were home in school, and helping them, first of all, to understand what was happening on the entire planet, what the pandemic was, to understand that they could live life safely, that they didn't have to live in fear, but that there were some new behaviors that community health workers wanted to bring into families, into homes, into places of work. So CHWs were helping to do that. And then in addition, they were helping do, all of the day-to-day things that help people stay healthy, like helping people to manage their diabetes, helping people to remember to see their doctors and go to their doctor appointments or take their medications. So the pandemic, it disrupted life, but life continued, right? And so the day-to-day struggles that people had needed to be addressed, and community health workers helped with that. And then they brought new skill and new information to the community so they could protect themselves.
And I began hearing from the ambassadors and from our membership across the country that their community-based organizations were closing down, that they were not able to get funding to do what they needed to do to protect people and keep them safe. And so when our community members began losing jobs, when the schools closed and the children had to go home, when it was difficult for people to get their medications because when they lost their jobs, they lost their insurance. Many community health workers were desperate, trying to connect with their clients and the families that they engaged. It was a difficult time. And then all of a sudden, people started to say, we need community health workers. Oh my goodness, we need them because they're trusted, because they speak the language, because they know where people are, they know who is shut in, they know where the elders are, they know what the children need. And so all of a sudden, they began to ask us. Sometimes they asked us to do work for free. I don't know if you experienced that, but many community health workers did. On the mainland, the tribal nations, there are over 537 tribal nations that are recognized by the federal government. Over 200 are not recognized by the federal government. And they did not get funding when the states got funding. It took months and months, and so people on our tribal nations suffered. The National Association, as a small organization, began to advocate. And we said three things. Number one, that all states and territories and tribes and the federal government should acknowledge community health workers as critical infrastructure workers during the COVID-19 pandemic, as professionals who should be paid to respond to the pandemic. That was number one. Number two, we said that our community-based organizations, our coalitions, our alliances, our networks, our associations should be invested in, that state health departments, that the federal government should get funding directly to our community-based organizations. And number three, we said that CHWs were leaders and that they should be respected as leaders to come to the table, to your task forces and your COVID alliances or whatever it was that your state or your community was organizing to develop strategy. That we were leaders, not those who just do what others ask, but that we are leaders who can guide the direction of the programs, the services, and the strategies. So I know that the community health worker tradition goes back many, many decades formally in this country, but I imagine that even before the 60s and the 70s, which is when a lot of people think that CHW is just that someone planted us and we just sort of started growing up somewhere, all of our communities had these people. On the plantations of enslaved Africans, there were millions of us living without any wages, without access to any doctors. Some of us slept outside, some of us slept in cabins. Who kept us healthy? Who cared for our mental health? Who helped birth our babies? Who helped us when we got ill or had a snake bite or got a cut? Who was navigating Western medicine and helping us connect with indigenous practices? Who kept our communities alive when mentally and emotionally and spiritually we were losing hope? There have always been these traditions. And so it is important from the National Association, we encourage you and support you maintaining and sustaining and incorporating all of your history into the current activities in Hawaii. I won't go into too much detail here, but I have heard and I am learning more about what is happening in your state. It is always the case that we have to advocate. Black and brown people, indigenous people, will always have to advocate. And so I encourage you to stay healthy and to stay strong and to stay united. Unity is our strength. While I do not have your history, your culture, your language, your faith, we are unified as community health workers because we care about our people and our communities. We understand that we will combat structural racism wherever we find it. We want to build bridges and ensure that dollars flow and resources flow and respect flows and power flows into our communities to keep them well. And so this is a sign of unity. That's what this is. I'm so honored to be here. This is the first public event that I've been able to attend since the pandemic. Because I'm a person with an underlying health condition, I stayed inside a lot. It was a very lonely time. I gained a few pounds as well in that couple of years staying at home. Hopefully some of you are with me on that. I did gain a few pounds during that time. So this is a celebration for me. And I don't come to bring you sorrow, I come to bring you hope. Because we are absolutely the answer. We will not address health disparities and health inequities. We will not prevent chronic disease. We will not ensure that our babies grow and are healthy. We will not care for our elders and allow them to live a long and prosperous life without community health workers. Doctors cannot do it alone. Social workers cannot do it alone. Researchers cannot do it without us. Public health workers cannot do it without us. Epidemiologists need us. Nurses need us. Pharmacists need us. And so we should stand very proud in our profession. We are self-determined. We determine our scope of work and our practice. It is never the case that you would find a lawyer telling a doctor what it is that they can do, right? You would never find a lawyer telling a doctor, now this is how you can provide services, and this is your scope of work, and I'm gonna train. It's never that case. So why do we imagine that a doctor, someone who has never lived in our community, someone who does not know what it's like to be poor, does not know what it's like to be brown, does not know what it's like to experience racism, that person alone cannot transmit what we need as community health workers to go back into our communities and heal. This is a tradition. And yes, we can glean from public health and from clinical practice and behavioral health and all the expertise, but we are a profession. If you do not know anything about the National Association of Community Health Workers, we invite you to visit our website, to visit one of our free webinars. All of them are free. If you're already a member, I want to thank you for being a member. And we have an annual conference coming up in August 3rd and 4th. And if you're a member, it's completely free for you to attend. And some of you may even be presenting. I don't know. Other staff members are collecting all of the presentations, so I may see some of you presenting. I want to again thank my Auntie Jessie for bringing me here. She brought me to Kau, and I, again, have only known her through Zoom for the last 2 years, and she trusted me enough to allow me to come, so I'm very grateful. I don't know if there are any questions, but I'll be here all day today and tomorrow, and I am truly here to learn and to support. I want to thank Papa Kulea for allowing me to spend some time with them, and Hui Nicole's organization, and of course Kau, many other organizations that I am meeting. Stay strong and stay united as a profession. Do not let things come in and divide you. We know how to traverse our cultural and our traditional differences, but we must be united as CHW so that we can be respected and protected as an organization or as individuals. So strengthen your organizations as well. Support your organizations. Bring your youth into your organizations. Draw from the wisdom of your elders into your organizations so that these young men and women here and many others can carry on that tradition.
Thank you so much, for coming and for giving us such a moving presentation. First off, I apologize for no shoes, but if you know me, I am most comfortable in jean shorts and a t-shirt. And my team, I came today in jeans and a t-shirt, but I was told by my team I had to bring a dress, and so you can see which one of us won. It was them. So you can thank them for dressing me appropriately today. So it is my honor to be here. I am so humbled. The story that I tell is not my story. It is all of yours. And it is, hopefully, my prayer is that I do you all justice, because it is the work of all of you that is on display every day, that represents your communities, and that makes sure that your communities receives the services that they are so in need of. My story begins in August 2020 with then state epidemiologist Sarah Park. All of us remember her. She had a lovely news conference in which she said, we know Pacific Islanders are overrepresented in our cases, approximately 50%, but we have no one on staff who speaks their language, and we are having a difficult time hiring because we don't have anyone that's educated in this field in order to do that. Enter me into the UH West Oahu, which thank you Dr. Tina Tawasosi, who said to me, Telly, can you go join the UH West Oahu contact tracing cohort, and let's see what you can do. So I joined the cohort a little late,
I missed maybe 2 to 3 weeks, and I very quickly had to pick up what was contact tracing, what needed to be done. And what I realized is they were just telling me to be a community member. They were telling me to go into my community. They were telling me to talk to my community. They were asking me, what does your communities need? And I was saying, well, they'll tell you if you ask them. They were saying, what does it take for them to isolate and quarantine? Well, they live in multi-generational homes. What is that? Well, that's what we do. We want to be with our family. We want to have Tutu there. We want to have Papa there. We want to have auntie, uncle, all of our kids, because that's what's normal to us. That's what means something to us. And so I then, after I finished that, applied for the job, and to my surprise, I didn't get it. And I was like, wait, what? So I called Dr. Tina Tawasosi, and she said, you need to send an email. And so I sent an email to the new lead of contact tracing, which was Emily Roberson, because Sarah Park was asked to retire, step aside, and go do her own thing, which we are all grateful for. And I sent Emily that email, and I said to Emily, I don't know what more I need to do, but I put my application in, and she said, you know what? I'm so glad that you reached out to me. We are actually going to create the first ever Native Hawaiian Pacific Islander contact tracing team, and we would like you to run it. Jaw on the ground, and I said, why me? And she said, well, yeah, Pacific Island Studies, that's my academic background. You seem to get along with people, and they like you. Really? Me? I'm not really a people person. If you know me, you know I tell everyone, I don't know. I'm prickly. So, because there was no one else, I said, okay, fine, I'll do it. So my first thing was getting hired, which took a process. When they say working for the government is hard, they are not kidding. So 4 weeks into it, and I'm already sending emails out to all of you, because I'm saying to you, we are creating the first ever Native Hawaiian Pacific Islander contact tracing team, and I need your members. I need your advocates. I know you guys aren't comfortable working for the government, but if we're not here, who is? And please, send me those you would want to work for you, and not just your cousin's cousin. And so I was blessed to have 12 applications come across my desk. Marshallese, Samoan, Hopi, Yakpis, Tongan, Filipino, Tagalog speakers, Ilocano speakers, Cebuano, or better known as Visayan. And I did my due diligence, and I hired them. And as soon as we started doing contact tracing, what we realized is our communities will give rote answers. We're trained. If somebody says, how are you doing? I'm fine. Do you need anything? No. How are you? I'm good. That's not the answers we needed. We needed to find out, why were you still getting sick? Why were you passing it along to those that you live with, even though we know you care about them and would never choose to do something to hurt them? And what we realized was they needed resources. No other team thought about that. I mean, they live paycheck to paycheck. They live multi-generational. 5 people have to work in order to live in one home. It should have been common sense. So what we did is we started to create resources and collaborative partnerships. And we reached out to WOW, and we reached out to Project Vision, and we reached out to Keola Mamo, and we reached out to everybody that we could and said, what do you have? What can you bring to the table? And then we created a resource guide. The next thing that we realized is data collection. Umbrella terms like Pacific Islanders hide those communities within our larger community that are being overly affected. So what we started to do was we started to say to people, what race are you? I'm a Pacific Islander. Which island are you from? Which island am I from? Micronesia. No, that's another umbrella term, and that's actually a region in the Pacific. What island are you from? What is your ancestry? And very quickly we realized we found the top 3 that needed our help. And so then we started to say, what do we need to do to get into these communities? And we went to these communities, and much like we do in our Pacific Islander way, we knocked on the door and we said, we're here to help. What does that look like? What do you need from us? Tell us what you want to do. We're not going to come in and put up a tent and just expect you to join us. We want you to guide us. And they said, educational outreach. Okay, awesome. And what does that educational outreach need to look like? Well, it needs to be done by trusted messengers. Me, who works for the Department of Health? No. This needs to be done by the community members that were hired. What language does it need to be in? Well, it needs to be in their language. Because if it's not in their language, then we're not getting that information to them in a way that's meaningful to them, in a way that engages them. So we very quickly mobilized. We did some test runs, which we were lucky enough to have our kupuna, our matua, our elders say, present it to us first and then take it out into the community. And that's what we did. And then when we showed up with the kupuna and our elders, it gave us the authenticity and the validity and the comfortability within these communities to have those hard discussions. We know you have COVID, Auntie, don't be embarrassed. There's nothing to be embarrassed about. It's a disease, but I don't want to leave my family. Well, we have ISO-Q units, and you know what we're going to do? We're going to take you, we're going to pick you up, we're going to call you every day, and we're going to have somebody who speaks your language ask you, how are you doing? Are you feeling well? Do you need something? Well, I need citrus leaves, I need ginger, I need lemon. Okay, how do we get that to you? And then for those who are from Micronesia, I need betel nut. I don't know that I can get that. Let me see what I can work out. And then of course the elders would say, well, this is a good time to get them to stop, so don't take it to them. Which was awesome, because we were like, your church leader said we're not supposed to bring this to you. It's okay, my wife will drop it off. No! It was those types of situations. And so we were able to mobilize and get out there and create those collaborative partnerships, whether it's community health worker, contact tracer, outreach coordinator. So once we had this all established, then of course as time went on, the next thing we had to address was vaccines. Now, given our shared colonial history, having someone put up a tent and stick stick a needle in your arm wasn't really something we all wanted to do. And we had lots of questions that were not being answered because honestly, they weren't being answered in our language. So what did we have to do? We had to go back to the drawing board and we had to say again, who needs to tell these stories? Who needs to be there at the table? So then we started holding vaccination clinics, and we had to have medical providers who were inclusive, who understood that we have to be at a church because that's where they feel safe. That's where they know. We had to do it on weekends and we had to do it after hours. We couldn't just say, you have to show up Monday through Friday, 8 to 5, go online, fill out this paperwork. Have you met my grandmother? Have you met my uncle? Yeah, that's not happening. So we had to make sure that we had paper forms. Not our favorite thing to do, but that's what they needed. And so that's what we did. And then we had interpreters there. We had translators there. We had drinks for them. We had stories. And we met them where they were at. If you're going to do something for us, it needs to be by us and with us. So then, of course, we hit the wall, right, guys? We got through the first part of the vaccination, and then everybody started feeling safe. Our numbers were going down. People were like, I don't need to get vaccinated. And then we started to hit that curve, and the numbers started going up. People still weren't coming to get vaccinated. So by this time, my bosses said, well, you did such an awesome job with contact tracing. You want to try your hand at vaccines? Yeah, I guess so. So luckily, I had done a concert with Dr. Tina and the NHPI 3R Pacific Islander sub-team. And during that concert, we had lots of people come. And we had it in all these different languages. We had Pohnpeian, Yapese, Marshallese, Trapeze, Samoan, Tongan. We tried to be inclusive. And we were lucky enough at that time to have been introduced to entertainers entertainers that people knew and had been there for a long time. And so being the person that I am, I said, hi, you thought about doing vaccine clinics? What would I do at these vaccine clinics? Well, you would talk story. What are we going to talk about? I don't know. I mean, you're a comedian. Figure it out. And then what else am I going to offer them? Let me think. Well, when I go to a party, I like music. What about you? Yeah, that works. So all of a sudden, then we were including music. We were including entertainment. But we weren't calling it entertainment. It was educational outreach. And how that educational outreach worked was, if you're sick, stay home. If you have a question, here's a kauka. Ask a doctor. Not only that, if you need help, here's the number for food. Here's the number for rental assistance. Oh, and by the way, there's a representative right over here if you're ready to fill out that paperwork right now. And so we realized, what does our community need? And we let them guide us in that process. And that's what all of you guys do, right? You don't go into the community, you don't set up a tent with nobody there and then just sit on the side of the road and at the end of your 4 hours say, nobody showed up, we tried. What you do is you go out and you connect. You're the auntie, you're the uncle, you're the cousin, you're the nephew that gets somebody else to pull on the side of the road and say, what are you doing here? Auntie, we want to work with you. But I'm afraid. Well, I'd be more afraid of having COVID and not having something to protect you. I loved it though when the big guys came with all the tattoos and they would tell me that they were afraid. And I'd be like, really? This is one needle poke? I'm pretty sure that took you 5 hours. And then they would look at me and go, really? And I'd be like, yeah, I know. And then they'd end up getting getting vaccinated. And it was because we knew how to engage with them. And that's your superpower, guys. You know the communities, you're part of them. And one thing that I thought was awesome, that I still kind of am humbled by, is the fact that inclusion and diversity brought about change. Pacific Islanders went from 50% of the cases down to 20, down to 12. And now they kind of hover somewhere between 12 and 15. Now I know all of you data people will say, well, you can't show causality. You're right, I can't, but I can say I was there. And you were there. And that is enough. And that's what we have to remember, guys. You're all enough. And I will tell you, after 2 years, I have panic attacks, I have anxiety, I wake up and I just think, and I do my work in my sleep, so I'm doing it twice a day. But I'm grateful because I know at the end of the day, somebody's still here because of what I did. Somebody's at a graduation because they came and got vaccinated. Somebody's at a wedding because they chose to get tested. Somebody didn't lose their house, thank you, because they were able to get rental assistance. And that's what this is all about. It's meeting them where they're at. I know my time is coming to an end, but I wanted to say this. And guys, I have to apologize. I am Samoan, but I was raised in the mainland and I don't speak the language, which has always been kind of it's a touchy subject for me. But when we talk about these things, mo tato, o tato, for us, by us. For Hawaiians, no kako, na kako, for us, by us. You're the solutions. In the Samoan culture, we have a proverb. I won't say it in Samoan because I will slaughter that in my apologies. But when you step on a starfish, the way to fix it is to take the starfish and rub it on it. That doesn't necessarily mean that you have found the cure for it, but what that means is you know what the solutions are. The solutions are found within your communities. Lead them, guide them, be the voices. You are not voiceless. Unfortunately, you're just being ignored. I have found that out the hard way as I have spent time at the Department of Health. I am a thorn in all of my boss's sides. They will tell you that every day. I am told that my passion is off-putting, I am too much. I tell them, go find less. I am who I am, and I am grateful for that. And so I know I got my 2-minute warning, so I will be very mindful of the time. But I just want to end this by saying to all of you, thank you. You may not hear it, you may not see it, you're probably getting paid way less than you're worth, because I know I am, but you're making a difference every day in the life of your communities. You're leading them, you're guiding them, you're amplifying their voices, and you're doing the hard work. And that's what's important. We're the workers, we're the voices, we're the people. Lava for all of your patience, for allowing me to come here. Again, super humbled by this, but thank you all so much. And I'll still be here, without shoes on, by the way. So try not to step on my feet, but if you do, that's okay. Mahalo, guys.
And aloha and aloha. We thank the Ulu Network community for inviting us. We're grateful. It's an honor to be here today. This is a group of Pacific Islanders. I work at UH Monroe. My name is Tina Tawasosi-Posulai. We have Pastor Jordan Callan. He's Pohnpeian from United Church. He's the pastor. So grateful for his presence here today. We have Chukis, Marshallese, Samoans, Pohnpeian, Yapis, and the ladies right down there. The program that I work at University of Hawaii in Manoa is called, I change the name all the time. When I have funding here, I change the name. I got funding over there, I change the name. Now I got another funding, I change another name. The reason why, no funding from UH Manoa. We don't come to compete. I say this many times. We are not here to compete. We are here to create from the Pacific Island perspective. But we are very grateful. When the pandemic happened, that little program that I have at UH Manoa with no funding, it brought together Tally's team, contact tracers, that helped so many Pacific Islanders, even Filipinos, Native Hawaiians, because of that network. I reach out to Chantal, reach out to my other Pacific Island students, they all joined that group. Grateful that everybody's here today. Thank you, Chantal. And Pastor Jordan joined the team as well. He's a workaholic. Yes, Pastor Jordan is a workaholic. He came and helped and distributed and saved so many lives of so many Pacific Islanders.
Pananim, aloha. Aloha. My name is Pinasia Joseph, and I'm going to tell you 2 interesting facts about Chuk. Chuk is the home of great navigators, and it is also known as the paradise diving.
Kasalelia Mango, aloha. Aloha. My name is Brianna Edwin. I'm from Pohnpei, and here's 2 challenging things I've been experiencing about cancer. 1, chemotherapy, and 2, surgery. Kalangan mahalo.
Kasalelia Mango, aloha everyone. My name is Lillian Mikkel. I'm also from Pohnpei, and I am going to tell you 2 interesting facts about Pohnpei. Number 1, Pohnpei is known to be the most famous worldwide surfing places, which has awesome waves. And number 2, it is also famous for its energetic dance moves that we do. Mahalo and thank you.
Aloha, mongete,
My name's Trisha Cometa, and I will be telling you guys 2 interesting facts about Yap. Yap is known as the land of stone money, and it's also home for navigators who still have great navigation skills till today.
Aloha, my name is Arasi Tuilumotu. I'm from Western and American Samoa, and an interesting fact about these 2 is one is Americanized and one is independent.
Now, shout out to Leroy Richard's song.
And for your protection, that when we come and when we leave, we'll all be safe and happy, and let us make great memories, and let us be a successful event, and bless the food, and bless those hands that has nourished and made all of the foods and drinks, and mahalo to every staff here at Kola Ballrooms. Please keep us safe from any danger or illness, and in the name of Jesus Christ, amen. Amen.
And was said to have superhuman strength. He foreshadowed the inevitable by conquering all. He band together a group of spear-fighting men, had them trained for battle, and called them his key warriors, named after the icy cold rain of their home district, Waimea, Hawaii. In 1790, after attaining control of Hawaii, the Big Island, he successfully invaded the islands of Maui, Oahu, Lanai, Molokai, and Kauai. He was able to conquer and unify them under his rule, earning him the title Kamehameha the Great, who established the Kingdom of Hawaii. On May 8th, 1890, he died in the district of Kona, his remains hidden in secrecy that only the stars know his final resting place. Einoa no Kamehameha.
As we feature them in a hula, speaking about the poor Iliahi. Hello, 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 hello.
Across the planet in pretty much every community, community health workers are being talked about like never before. And CHWs, if you're a CHW, you should be really proud of that because our profession is not always known or understood or well compensated or respected as a profession, but we helped folks in the medical field and in clinical practice. We helped folks in public health and behavioral health to, again, bridge all of the gaps that are across our communities and populations. We love our communities and we're from every community, urban and rural and Black and Polynesian, Hawaiian, Latino, you know, we are everywhere. And so we look like the people that we serve. So you should be very proud that you helped keep your community safe, that you know, global organizations, the federal government in the United States, your state health department, everyone is talking about you now. And so now is the time for you to say, I'm here, I'm a professional, I am a leader, right? I have something to say and something to give that can make the community better.
We mahalo you for your service. We mahalo you for continuing to put yourself on the front line and your families on the front line, because even though we don't see them, you go home to them. And so we mahalo that, and they continue to support you so that you can support our local communities. So that's the first thing I want them to take away. The second thing that I want our attendees to take away is the fact that they've risen to their kuleana. So now it's our turn to also uplift them and help them in their respective profession. The third thing that I want them to take away is the fact that they've built Pilida here, and that they know that they are a part of a larger community and a larger network. The Ulu network is a bunch of health communities across of our state of Hawaii. So today we have people from Molokai, people from Kauai, people coming in from Maui. Everybody's here to share what they've done and what has made them success, as well as we can bond over all of the things that didn't work so well during COVID. So I hope that they take away the fact that, you know, they have pilina with each other and they have each other as strength. So